All right. This audio will wrap up the bone portion of this PowerPoint. The remaining half of this PowerPoint is about joints, so we'll be starting that in the next audio. Here we're going to discuss a couple of bone conditions. This is not an exhaustive list. There are many, many bone conditions. This is just a couple. So first and foremost, a bone condition that we have actually discussed before, osteomalacia. Osteomalacia is a homeostatic imbalance due to insufficient calcium in the diet or insufficient vitamin D. Remember, vitamin D needs healthy liver and healthy kidneys, as well as UV light exposure in moderation. I'm not saying go out and spend 10 hours in the sun and roast yourself to a nice red color. That is not conducive. Little bit of sunlight, little bit of UV is all you need. The last estimate I saw was early morning sunlight, so like 7, 8 o'clock in the morning, one arm, 15 minutes. That's the minimum that you need. I don't know, that piece of research I saw is now 15 years old. I have not looked into it recently. I've been focusing on a couple other things, so that could be out of date now. So use it as a rough guideline. So if I don't have enough calcium, I don't have enough vitamin D, we are going to leach calcium from our bones to maintain adequate blood calcium levels. This will enable us to have proper nerve function as well as proper muscle contractions, but this is going to cause bones to become soft and weak. Not to be confused with rickets. Rickets is essentially the same thing, but in children. We have an insufficient calcium in the diet or vitamin D deficiency. We're going to leach calcium from the bone, again, to maintain proper bone levels, or blood calcium levels, causing soft and weakened bones. But because children are growing and we are needing the calcium to replace cartilage, creating strong, healthy bone structures, this is going to lead to bone deformities, with bowed legs and deformities of the pelvis, skull, and rib cage being the most common. That's actually what is being shown here. Quite frequently, children who have rickets also have other malnourishment issues, and so they do also typically present with a protruding abdomen or a little pot belly. It's not because they're fat. It's not because they're overweight. It is a maladaptive mechanism to try and maintain as much nutrient and as much calorie as possible. So when you see that in a child that has like stick thin arms and bones, but they got this little belly, it doesn't mean they're getting enough to eat. In fact, it means the exact opposite. Osteoporosis. What is it? So in order to diagnose osteoporosis, we are going to need to do a DEXA scan. What does a DEXA scan do? A DEXA scan measures bone density, bone mass. And we are typically going to do a DEXA scan of the head of the femur. The spine are the two big ones. Why? Because the spongy bone of the spine and of the head of the femur are some of the most vulnerable. Why that is, we're not really sure. In women who don't know that they have osteoporosis, or in women who do, how does this typically present? They may not feel any different. They might not feel fragile. They might not feel weak. They might be like, okay, I have this diagnosis, big whoop. And then they go and they sneeze, or they step off a curb, or a stair. They bump their hip against a table, and they get sharp shooting pain as they break a rib, the head of their femur, a vertebrae, because the bones have become fragile. Not necessarily going to feel that until it's too late. Typically, osteoporosis is actually a group of diseases that all deal with bone reabsorption outpacing bone deposition. So there are subcategories to this, but quite frequently this is going to be seen in postmenopausal women. We do see it in not postmenopausal, but that same age group of men, and we're actually seeing it more in men as more men are stationary or sedentary for more of their day, so more office job, more sitting at a desk, less up and about and moving. We are seeing it more. So, while women postmenopausal are still the primary category, we're seeing it in men more and more as well. The reason is the same. Reabsorption, outpacing, depositing. Calcium is leached from the bone to maintain adequate blood levels, just like with rickets, just like with osteomalacia. The problem is this isn't due to a nutrition deficiency. However, making sure you have enough calcium in your bloodstream through your diet can help slow down and occasionally reverse osteoporosis. It depends on where you are in that process and what's going on, what other treatments you're on. Treatments. Calcium and vitamin D supplements have been the go-to. Increased weight-bearing exercise. As I mentioned, this is a little old. We now do recommend, if you are able to, lifting weights. Heavier the better. Hormone estrogen replacement therapy, known as HRT, has been shown to slow bone loss down. There was a huge controversy in the 90s about HRT because it does have in a selection of women deadly side effects, heart attack. So there's this huge court case that happened in the late 90s about that. It is still prescribed. It's just one of those risk outweighing. Does the risk outweigh the benefit? The benefit greatly outweighs the risk. Your doctors will still prescribe it. Natural progesterone creams have been shown to help promote new bone growth, and they're actually playing with statins. Statins seem to increase bone mineral density as well. However, statin medications have their own risk and side effects that come along with them. All right, so that is the end of bones. As I mentioned, just a couple of bone diseases. I'm going to start joints next audio.